My name is Deborah Battistella, and I am the host of the OT Meeting Room. Thank you for joining me today, and I want to begin by saying I'm going to speak about my experience at the hospital on Saturday, the last day that I am working for at least 30 days, or possibly 30 days. I could go back sooner. I've been furloughed. And I want to speak about my experience and how to continue moving forward in uncertain times, and how to advocate for occupational therapy, because this YouTube channel, my business is all about occupational therapy, promoting occupational therapy amongst ourselves, helping ourselves to be able to articulate our distinct value so that we can promote occupational therapy to others, to other disciplines, to physicians, to our patients, so that the ultimate reach is to provide good services to our patients. And so today I am wearing my heart-brain coherence shirt to remind me to keep my heart and my brain working together, because when I have heart-brain coherence, I am a nicer person. I think that I show up in a better way. And a little plug for the holistic piece of occupational therapy. I consider myself to be a spiritual person, and so I love the spiritual aspect of OT. All right, enough about me. Let's talk about staying positive in uncertain times. So on Saturday, I was able to go do what I love to do, see some patients for occupational therapy. I did mainly evaluations. Working in critical care units, it fluctuates in acute care, where there are often many evaluations and fewer treatment interventions. And there were a lot of new people in the critical care units who needed evaluations on Saturday, and so that's what I did. And I chose to have a positive attitude. I chose to keep my head in the space of loving OT and enjoying the connection that I get to make with my patients, and that I was able to make with my patients, and providing occupational therapy services in the best way that I know how. Additionally, I did some advocating for OT. As I mentioned in the video I made on Saturday before I went to work, I have concerns about the role of occupational therapy and our early mobility program at the hospital that I work in. Now, if you're one of my colleagues at the hospital, if you're not an occupational therapy practitioner, please understand that I appreciate you. I appreciate all of us, our team. I think we have an amazing team. My intention in this post is to help people, whether you're an OT practitioner or not, to understand the value of occupational therapy, and to perhaps have a good dialogue about how OT services can be provided and why OT should remain. Because I do have concerns about the viewpoints of early mobility from a management and upper management perspective, from the perspective of the decision makers in our system. So what I did on Saturday was I just advocated to every person that I thought I could, who would listen and who was able to help. And so I did speak to the medical team who was there on Saturday, and I expressed my concerns to them about what's going to happen with occupational therapy in terms of service provision in the early mobility program. And I spoke with these two amazing nurse practitioners. They're just so intelligent, and I love working with them because we just work so well as a team. And if you've had the opportunity to work in our neuro ICU, if you're one of my colleagues, then you know that the medical providers, everybody in their own unique way really does show up well to support our patient population. And that is one thing that I absolutely love about working there. And so my concerns were and are that leadership will view the early mobility program as mainly physical therapy can provide all of the services needed. Now, the two nurse practitioners that I was speaking with do not share that opinion. They absolutely understand the role of occupational therapy and the value of occupational therapy. They understand the difference between OT and PT, and I felt encouraged by that. And I asked them if they would consider advocating for us anytime they have an opportunity. And they both assured me that they will. And they both feel that early mobility is not going to go away. They really do believe that our hospital does a great job of helping the patients who come to us as a result of the early mobility program. And so that made me feel a little bit better. The other thing that I want to talk about is just how we can encourage one another. I've been having many conversations with OT practitioners, both in the system that I work with and outside of my current system, because there are so many people who are getting furloughed, and it's scary. It's frightening. You know, I mean, we're doing what we love, and we sometimes get fooled into thinking that employers have our backs, and employers have to take care of themselves. They have to keep themselves afloat. And so in the big picture of life, it doesn't necessarily mean that they don't have our backs. What it really means is that they have to keep the business afloat so that they can continue providing the services that they provide to their clientele. And when we look at things from a more objective perspective, both the system and ourselves, or anything more objectively, we can keep a more clear head about ourselves and think more rationally and think more in terms of how can I help myself advance, and in my advancement of myself, what can I do to help others? And when we enter the service mentality from a healthy giving perspective, I think that we will find our own personal value and the value of occupational therapy within that, because each of us brings a unique perspective to our practices and to our patients. And so I want to encourage you to look within yourself, to identify your own special skills, because we all have unique skills and talents that set us apart from the other. And what are those skills and strengths? And how can you use those to help yourself? Do you want to start a business? Do you want to partner with somebody? Do you want to create something that has an OT focus that's not necessarily occupational therapy? I mean, there are so many different ideas and avenues and ways that we can go with anything. And when we consider things like this, like other opportunities, then we help ourselves. We're helping to expand ourselves, and we're helping to expand our profession. The other thing is allowing yourself to feel the feelings that you're feeling, but don't stay there. So identify if you feel pretty crummy, identify how it feels in your body, and do something to help it pass through. Acknowledge it, spend time with it, and learn a little bit more about yourself. I'm a reflector. I love pondering and reflecting. It's a routine that I carry out every day, and it helps me. I love to go to the local Tim Hortons coffee shop, get myself a delicious cup of coffee, find some nature, preferably with a body of water, and sit and ponder and just be there with nature. And something about that helps me to feel centered and calm. And when I feel centered and calm, I'm open. It opens me up to know myself better to know the things that trigger me, to know the things that help me move past a trigger. It helps me to think clearly and to show up in a much better way, whatever it is that I'm doing. Let me wrap this up, bring it all home together. So number one, advocate for occupational therapy where you can. Find the people who value occupational therapy. This always reminds me of Mr. Rogers. Find the helpers. There are service providers who have truly a caring heart and understand the value of our services that we bring to the profession. Find them, advocate for OT. Form and have relationships with them that are professional and enhance their practice, and understand what it is that they bring to your practice that enhances occupational therapy. Number two, feel your feelings, allow yourself to feel what you feel, and just try to move through it. Don't try to push it away, move through it. And think about ways that you bring value to occupational therapy. What is it that you love about OT? And can you use your skills in another way? How can you use time if you're furloughed? How can you use this time to change your life if you need to, change things up a little bit, and show up being you. So my concerns about my job still are there. They're still there. I still love OT. I still want to be an early mobility therapist. I still want to help people who don't understand the true value of OT to understand it more, to know it better. I still want to help bring us together as a profession. I still want us to be able to talk about OT-related things and consider possibilities that are being presented to us as a result of the changes in our job situations, the way that services are being delivered due to the COVID-19 pandemic. So let's keep an open mind, let's encourage one another, and let's continue to advocate for occupational therapy and bring OT to newer heights to the world so that people can experience the benefits of our services. Thanks for watching. Make it a great day.